Oh, I wanted to start the video, but you don't allow me.
Hi, Katerina. Yeah, I can hear you.
Harsh, who are you?
Marissa.
No, I know, host. But how are you?
I'm good. So I am right now promoting our speakers to panelists, but I believe everyone can hear us now because we're broadcasting.
Who is Macdeus? Macdeus? Haha, heard you coughing. Who is this person? Let me click and see who this person is. I don't know who this person is. Hi, Lilani. So nice to hear your voice now, to see you typing to me. Hi, Nepal.
Hello, good afternoon.
Good afternoon.
Unable to sorry. So you can hear me. It's late. Good morning.
Hi.
Hello.
I haven't heard your voice for such a long period of time.
Likewise. It's nice to hear
How
yours.
are you, Lilani? Do you feel now as a free woman, almost?
Almost free.
And congratulations on the new job.
Oh, thank you. Thank you.
Are you happy?
That's cool.
You must be. You must be
I
very
think
excited.
so. I'm tired. Katerina, you know.
I know.
I'm super tired, but no, it's really great. Everything's good. Everything's good. I'm really happy to be here.
Good. Now we are very happy to have you here.
You
so
should
are
wait.
you by any chance friends with Trudeau? I'll send you a private message.
Send me a private message. I'm not friends, but I wouldn't say I'm friends.
Okay.
And I have my own battles with them at the moment with homelessness and COVID. It's really bad here.
Oh, my goodness.
Yeah.
So Katerina, excuse me, Leilani, I'm sorry to interrupt. This is Marissa from the Secretariat. I just want to double check. Katerina, I know you're audible. Satali and Yost, if you could check that you can speak.
Check.
Thank you, Yost.
Marissa.
Yes.
I can speak, but I still have the problem that I'm not allowed to join using the computer, which would be more convenient. So I've just joined on phone right now. But later on, when things are moving, maybe we can try to resolve the issue.
Okay, that's great. And if we can just check with our other speakers, Morali. Morali, are you able to unmute yourself?
Hi, hello everyone. Can you all hear me?
Yes, thanks, Morali.
Okay.
And Dr. Oha from Nepal, I'm extremely sorry if I'm mispronouncing your name, but can you check your microphone?
Hello.
Hi.
Check.
Yes, thank you. That's great. To everyone who's joining, welcome. We are just getting ourselves set up technically. So if you give us just a couple minutes, we'll begin the webinar. I'm just trying to make sure we have all of our other speakers. Saima? Saima, could you please check that you can, that your mic is working?
Marisa, I think she needs to unmute now. So she is in here, but she needs to unmute.
Okay.
Saima, could you unmute?
Hello.
Hello.
Yes, I've just unmuted. Can
That's
you hear
great.
me now?
Yes, perfectly. Thank you.
Thank you so much.
Then if you could just remain on mute until we come to you, that'd be wonderful. Sheila, I have just added you as well. Could you make sure that you are able to speak? Sheila? Sheila Patel?
She says her mic is muted, so she can and she can't unmute herself. So let's see.
Okay, I did it.
Great. Okay,
Hi.
good. Thank you.
Sorry.
Hello. No
Hi.
problems.
It didn't, that button seemed unavailable to me till you did something.
Okay. Okay.
So I'm muting it again.
Yes, thank you. That'd be great.
We're all being trained from Zoom.
It's true. It's true. And thanks again to everybody who's joined. We're just setting up our speakers and we'll get started in just one moment. Emma, can you check that you can speak?
Who's Emma? Emma or
Hi.
Saima?
No,
Hi.
Emma from Malawi. Hi, how are you? Thank you.
Okay.
Good.
Good. Okay, great. Thank you. You're set. Okay. Great. I think we are. Joost, are you ready to take the floor, Joost? I think we're ready.
Yeah.
Joost?
Yeah. Can you hear me?
Yes.
Ready to roll? We're not doing cameras, right?
If you'd like to, you are welcome to. You don't have to if you don't want to.
Okay.
Same goes for all of our presenters. If
For
you
some
would like-
reason,
It doesn't allow us. It says you cannot start your video because the host has stopped it. So you were the...
All right, I'll look into that.
All
No,
right.
it's not the end of the world.
Okay. Yeah. All right. So while we are waiting for the video to be enabled,
Okay.
let's start the webinar. Good morning, good afternoon, and good evening from Water and Sanitation for All. So my name is Joost Kooijmans and I'm the Chief Operating Officer here at SWA. And I'm very happy to welcome you all to this webinar that we are convening with our co-conveners WaterAid and the Water Supply and Sanitation Collaborative Council, WSSCC, for today's webinar, which will focus on eliminating inequalities and making sure that no one is left behind in the WASH response to COVID-19. So I realize it's very early for some of you and it's quite late in the day for others. So we appreciate your commitment and your interest in this topic. So this webinar, as well as the last two we held, focuses on the ongoing and the rapidly evolving COVID-19 pandemic. and how we can most effectively engage to transform this biggest crisis that we're facing in our lifetime into a chance to do business unusual. And with business unusual, we mean that finally we can realize our vision of a world where everyone has access to water, sanitation, and hygiene when needed and where needed. As Kevin Rudd, our high-level chair, said during the last ministerial webinar, this crisis has made hygiene, sanitation, and water front and center of the response to COVID-19. And it should remain so even after. This webinar will so focus on two things. Firstly, on the plight of the most vulnerable in this COVID-19 pandemic, and the urgency with which we must address the inequalities in access to hygiene, sanitation, and water services, and to make sure that no one is left out, because we're only as healthy as the most vulnerable in our societies. So I have a few housekeeping notes that I'd like to share with you. So we're using Zoom for this meeting. This is the first time we're using it for these thematic dialogues. In the past, we used Skype for Business. So we are adjusting as Zoom might also be. So if there are little items that need to be resolved during the seminar, we'll be working very hard on them. So we're using the chat box as we always do. And we ask that right now that you add your name to the chat, where you are joining from, and if there's anyone joining with you, so that we can keep track of who participated in the webinar. We will have time for discussion throughout the webinar, but you're very welcome to leave comments and questions in the chat box, and we will come back to them. This webinar will run for about 90 minutes. To our speakers, may I request that you remain within your allotted speaking time. We're very fortunate to have the governments of Nepal, Kenya, and Malawi, as well as WaterAid, who will be responding to our request to learn more about this topic, this COVID-19 response and eliminating inequalities from their interventions at the national level. And then in addition, we're honored to have Ms. Leilani Farah, the Special Rapporteur of the United Nations on Adequate Housing, join us here, and she will close. Now it's my pleasure to introduce our SWA Chief Executive Officer, Ms. Catharina de Albuquerque, who will set the stage for our dialogue with a framing presentation. Catharina, over to you.
Thank you so much, Joost, and good morning, good afternoon, good evening to all of you. I have a technical question. Am I the one clicking, or will somebody else click for me?
I can click for you, Katarina. Just let me know.
Okay. Thank you so much. No, it's perfect. Thank you so much, Marissa. So thank you so much for everyone for joining us here. It's a pleasure to have you all. It's a great pleasure. Let me make a special reference to Leilani. It's the first time I think we have a special rapporteur talking in one of our webinars. And when Leilani was starting her mandate as rapporteur, I was finishing mine. And we did a joint mission to Detroit in the US to look at the water and sanitation and as well as housing issues in the city, the water cut-offs, but also the evictions of people due to poverty, etc. And this is one of the reasons why we thought, well, and you will see how an eloquent and passionate speaker she is, and you will see, and this is why we thought of her for this webinar. So thank you, Leilani, for joining. So let me start. Next slide, please, Marissa. Why we decided to devote a webinar to inequalities in the context of COVID-19. You know that the progressive elimination of inequalities and the principle of non-discrimination are crucial and are a guiding principle of human rights, and they infiltrate national constitutions, national laws, obviously international treaties, etc. And the Sustainable Development Goals also integrated the aspect of the elimination of inequalities, which, as you well know, did not form part of the previous Global Development Agenda, the Millennium Development Goals. In fact, it was one of the big gaps of the previous agenda. So all of these instruments is focused on elimination of inequalities. And we, of course, know, working on WASH, we know that the progressive elimination of inequalities in water and sanitation and hygiene also contributes to reducing the wider development inequalities. So we have within SWA, we have always focused on the elimination of inequalities, also because we are guided by human rights and of course by the SDGs, and because the elimination of inequalities, which is always important, is particularly critical during the current health crisis, as inequalities are exacerbated by COVID-19 in both the short and the long term. We are experiencing this everywhere in countries in the north, particularly with the impact or the economic impact of the crisis, and this will obviously be even more pronounced in the global south. I have seen on Facebook people saying that we are not all in the same boat. We are in different boats facing this crisis. Some of us are in small canoes and others are in big yachts. So we are in different circumstances, in different conditions when facing the COVID crisis. And we know that there are continuous health crises due to preventable diseases in many settlements around the world due to lack of water and sanitation. Unfortunately, this is not new. But as I said, the inequalities are exacerbated. People without access to wash are least able, to protect themselves from COVID-19, as they cannot protect themselves through washing their hands or other hygiene practices. And additionally, people living in densely populated settlements will find it very difficult to practice social distancing. Secondly, COVID is, as we all know, particularly dangerous for vulnerable people, whether due to age or underlying health conditions. So people living in informal settlements and in impoverished rural areas are again at risk due to long-term malnutrition and ill health caused by poor nutrition, by poor water, by poor sanitation, poor air qualities, and limited opportunities to also look after their health. So further, the daily incomes that many living in informal settlements rely on are reduced or lost entirely, and you know that, due to this crisis, meaning that food and water and soap and housing and other services and healthcare are impossible to pay for or at risk. If we think of people who are, for example, undocumented migrants, and we have seen this in some countries of the global north, they are afraid of leaving their houses and seeking for healthcare treatment in those countries where they fear that exposing themselves to doctors, to the public health system might put them in danger in the country where they are in an informal manner. So this current crisis has only increased the relevance of water and sanitation now and in the future. And in our response, we must continue to highlight the needs of the most disadvantaged and marginalized people and work to address this. This is critical now, as we work to protect at-risk people from the virus, from the impact of measures taken now and in the future to limit the spread of the virus, as well as in the future, as we continue to work to ensure that everybody has access to water and sanitation services to prevent preventable diseases, which already threaten communities the world over. Next slide. So what are the limitations of the lockdown in cities in the south? We know that the solutions that are being practiced in Europe, in China, in North America, well, in some parts of North America, may not be appropriate in the south. I'm thinking, for example, of social distancing, which have been of little value for those living in densely populated settlements. I have emails coming in, where many people may be sharing a room, where there is limited private outdoor space, and where people must leave the house, using very narrow streets to get the very minimum basics as water and also to use a toilet. So people who are incarcerated in prisons, in refugee camps, they are also highly vulnerable to the virus and require special measures. In my country, in Portugal, there was a recommendation by the UN High Commissioner for Human Rights for countries to consider releasing some of the inmates in order and put them in at home in order to avoid and to restrain the contamination. And there was big opposition here in Portugal, and the Prime Minister said that we see the humanity of a country by the way we treat the most vulnerable people in the community. And one of those categories are precisely those of prison inmates. We also know that in many countries, daily wages earners cannot survive without working or without external financial support. And most countries also have a very limited national safety net. Next one, Marisa, please. So what, oh, sorry, I made a mistake. What can we learn from previous health crises? We know that previous epidemics such as HIV/AIDS and Ebola have shown that the communities themselves are the best resources of approaches to tackle the epidemic. And communities best understand how to adapt existing practices that may put them at risk to better ones that will protect them. Any mitigation measures must be understood, must be adapted and agreed by the communities themselves, the communities that are expected, that are the ones expected to carry them out. So unless there is local organization and engagement with communities, as well as trust, no response will work. A heavy-handed lockdown, policed by the military, as we are seeing in some countries, will cause more unrest and will do nothing to reduce the inequalities that already exist, but will in fact exacerbate them. And importantly, this approach will not prevent the spread of COVID. This is one of the critical lessons learned from managing Ebola. Next one. Oh, let me just finish by saying that a collaborative, cooperative response requires integration of water and sanitation into other critical approaches in public health and social and economic support. Next one. Okay, then let's talk a little bit about the topic of information and data collection. Information must be cleared and must be clear and shared through trusted channels, including through local leaders who are familiar to the population and who use language and terminology that will be well understood. Misinformation must be tackled exactly the same way. Any mitigation measures must be understood, they must be adapted, they must be agreed by the communities, they must be explained to the communities who are expected to carry them out. Communities will know who are the most vulnerable individuals and will know how best to reach and protect them. Many settlements will also have carried out enumerations of who is living in the settlement and will know much more than the authorities themselves. Next one. Solutions. So if we follow human rights principles of non-discrimination, of participation, of access to information, of accountability, and also of sustainability, so following these human rights principles, as I was saying, is critical now as they are in normal times. Could we even say that it's even more critical now? These principles instruct all actors on how they should act. Community processes for managing the virus are critical for success, and therefore community voices must also be given the space to communicate with the city and with the national government about the difficulties that they are facing, particularly regarding the support that they require and the most appropriate ways of providing that support. We are seeing governments reacting with emergency handwashing stations, which is encouraging, but this must give way to long-term solutions that ensure access to water and sanitation for all, always and everywhere. Next one, and this is the last one. Protecting the vulnerable. During this webinar, we will hear from governments, but also from civil society organizations about how they are working to protect marginalized and vulnerable people from COVID-19 and asking some hard questions, including how do we use the lessons learned today to protect people in the future? Where decisions are made to reduce or remove tariffs, how does this benefit the poorest communities who don't even have a connection? Where we are asking people to stay in the home and keep at least 2 meters from others, how are we ensuring that public toilets are safe, open and accessible under these conditions? How are we protecting public water resources so that people do not pass the virus on simply from the handle of the water pump? These are some of the questions that we are putting to our panelists today. They are not easy. There are no straightforward answers, nor one-size-fits-all solutions. But we hope to be able to share some solutions, to share some good practices as a result of this webinar. Thank you so much for your attention.
Thank you very much, Katarina, I think, for a interesting presentation that sets the stage, illustrating some of the, I think, very real challenges that that cities and countries face. Also giving some parameters within which we have to look for solutions, and then also the very important message at the end, of course, that ultimately access to water and sanitation for everyone is a key ingredient of where we need to go. Thank you very much, Katarina. I'm now very happy to call on our first contribution from the Nepalese government, which will be given by Dr. Ajit Ojha, who is a senior division engineer in the Ministry of Water Supply in Nepal. Dr. Ojha, the floor is yours. Are you there?
Yep. So someone is going to change the slides for me.
Yes, Marisa.
Yes.
Huh?
Yep, no problem. Just let me know.
Okay. Thank you very much for the opportunity to have some sharing on this issue. So can we start with the slides? So I will start with the preparedness that we have done for the COVID cases. Our preparedness plan was prepared assuming 7,000 case loads and 700,000 population. We are nearing 50 cases till now. The worst clusters budget was $3.04 million US, and government has decided the hub hospitals in capital, and there are a number of satellite hospitals to deal with this issue. And the local government has made isolation centers and quarantine centers, but their capacity is yet to be assessed in terms of wash and other facilities. Can you move to another slide, please? So if we look at our wash sector, most of the water supply schemes are operated by the water user committees. There are some other urban operators such as Water Supply Corporation and Kathmandu Upatyaka Khanepani Limited. In terms of sanitation, the country is declared ODF. However, the sanitation sustainability is still a concern. And we were still to produce the data on hygiene in terms of national MIS. The constitution has given the operating right to local government now, and local government still needs capacity strengthening to operate the water supply in other wash facilities. Can we go to next slide, please? So when we started the preparedness, we started with the facilitation in institutional and communication arrangement at national and sub-national levels. The cluster was activated, which has the human resource, but it was difficult to trickle down to provinces. We are just initiating to trickle it down to the provinces. So we did the guidance note to service providers, local governments and provincial governments that what they should do in this pandemic situation. The guidance notes were prepared based upon the SPARE standards and other standards. The healthcare facilities wash assessment is ongoing with the help of development partners. And there are some supports provided to health facility. Beside that, the regular wash cluster mechanism is going on, where we are doing the 4W updating mechanism to assess what kind of capacity we have and what kind of response we are doing. Can we move to another slide, please? So during these situations, most of the challenges that we faced is mentioned in this slide. In terms of supply, we are facing, like for example, like disinfectants that come from abroad, and we are, since now landlocked country and the lockdown is happening, the stock options is limited. So some kind of the solution should come from the local level supply options for critical materials such as disinfectants that we are thinking now. And the mobility is limited, so we have to look on more digitized platform and digital literacy. In terms of regulation and monitoring, we are facing the trouble. So maybe for the next step, we should think about the digital platform for live monitoring and institutional arrangement for waste regulations as well. In terms of communication, the establishment of the communication channel between the layer of government has been initiated through the National Contingency Plan. The problem we think we may face is the multi-hazard problem as well, because the monsoon season is coming near, and if it integrates with the COVID pandemic, then the pandemic may be triggered more. So, and also the funding gap that might come in upcoming years is going to be the challenge. And some kind of research issues also need to be discussed because in some cases we are talking about, in some of the researches we are talking about, the corona virus is found in water and sewerage as well. So we should look to save the water users and save those waste facilities from those kind of vulnerabilities. So for that, we are seeking for the international expert support as well. Can we go to the next slide, please? So in terms of inequalities, if during this COVID situation, the local government initiated the subsidizing the water tariff, but since the operators may need some of the revenues to operate, then because the tariff has been subsidized, so its own kind of revenue mechanism also need to be looked upon now, and some kind of financial instruments need to be set down. There are few water user committees whose revenue generation was robust. They also have rebated the water tariffs. So the thing that we need, the discussion is going on the water trucking for the vulnerable and on-risk communities to promote the hygienic behavior, and also the distribution of water disinfectants agents in the poverty-stricken areas. So and also the impacts of COVID-19 on the marginalized communities and what kind of supply we can give to them. So to do all this, the WASH cluster is working together with women, children, and elderly related ministry and agencies to address the WASH need of those peoples. So for the long term, we need to think about the management information system that should be robust enough, which can integrate the other vulnerabilities layers such as poverty, marginalized group, and presence against the WASH service. So the screenshot that I have presented now is the live dynamic feed of our MIS, which will be seen in the next slide as well. If we integrate those our MIS with other MIS, which other MIS from the National Planning Commission and the Central Bureau of Statistics, then we can come up with where the vulnerable population lies and what is the water supply and sanitation situation there. So it needs to be multi-sectoral approach, and the data needs to be robust so that it could be decided properly that where the investment should go, so that those inequalities could be removed. Can we go to the next slide, please? For example, if we look at the hygiene data that we have not generated till now, and maybe we should think about generating, so we can see from the JMP's report that the richest and the difference between the richest and the poorest in terms of hygiene service, handwashing facilities, and the handwashing facilities, we can easily see that the richest have the access to handwashing facilities, whereas poorest are yet to prepare the handwashing facilities. So the first thing that we can do is introduction of hygiene in national MIS systems, and then the measuring the investment of the household levels, because most of the hygiene investment are in household levels, and we can think of some kind of subsidy mechanism in those households those vulnerable households in terms of output-based aid or those kind of things. And then also, since the local level, local layers of governments are the nearest form of governments, their WASH plan, the integrated WASH plan preparation is going on in Nepal, which would be instrumental to remove those inequalities, because they have the special focus on removing the inequalities, and these will all feed into the robust and live MIS along with financial planning, which will help to prepare the federal level government in terms of removing inequalities in WASH sector. Can we go to another slide, please? So if we look at this data, the yellow in the figure shows the data has already been started. The data, we have already started to collect the data in few places. We are thinking maybe within 6 months, within 1 year, we would be able to identify the category of WASH service, who is getting what kind of WASH service based on those data, and the ladder against the vulnerabilities profile, the WASH ladder, what service level they are getting against the vulnerabilities profile, and this would be interesting data to analyze and prepare the next planning for the WASH. Can we go to another slide, please? So basically, to put the policy and analysis into practice, the first thing should be to strengthen the local government on WASH sector programming and planning and monitoring, also both in regular and emergency in coming years. And that should be the federal level government's first agenda. Then output-based sectoral funding, that the local government who is doing good and who is putting the money in WASH would be facilitated by the federal ministry to empower the local governments and along with the capacity development aspects. And then to strengthen the vulnerable population, if we look at our sector development plan, it aims not to improve the WASH service of vulnerable population, but also to act as the empowerment wheel through the key posts and job opportunity in marginalized communities. The development finance support also needs to be looked upon, and it needs to increase post COVID-19. And finalization and materialization of pending WASH STP and conducting joint sector review would be another step forward, and moving towards WASH sector wide approach by increasing investment in WASH sector would be our step forward. So with this, I want to finish my presentation. Thank you very much.
Thank you very much, Dr. Oja, for, I think, a very comprehensive presentation that shows how you're rapidly adapting to the new situation, the measures you're already implementing to mitigate impact, especially on the most vulnerable, the importance of data, robust data, I think really was very central to your presentation. So thank you very much. Without further ado, and also thank you for sticking to the time. That's very important. With no further delays, I want to turn to our next contributor, who is Engineer Kimanti Chengo, who is the Acting Director of the Sanitation Management and Head of Development Cooperation Ministry of Water and Sanitation and Irrigation in Kenya. So Dr. Chengo, the floor is yours to speak about your experiences in Kenya. Dr. Chengo. Dr. Chengo. Hello. I don't think we have Dr. Chengo on the line, or maybe he has difficulty unmuting himself.
Dr. Chengo, you are unmuted from our end. Maybe on your maybe your device you've muted. Okay. Maybe yeah. I'll work with him offline, and then maybe we could move on to Malawi.
Yes. Okay. Let's do that. So let's wait for Kenya to come online, and then I would say that now we are switching quickly to Ms. Emma Mbalame, who is the excuse me, who is the Director of Water Supply and Sanitation for the Ministry of Water and Irrigation Development in Malawi. So, Ms. Mbalame, the floor is yours. Ms. Mbalane.
Thank you so much. Thank you so much.
Yes, go ahead, we hear you.
Yes, as the moderator has indicated, my name is Emma Mbalame. I'm the Director for Water Supply and Sanitation here in Malawi, in the Ministry of Water and Irrigation. I'll be making a short presentation in terms of how Malawi is doing in response to the current crisis that we have worldwide. And I'll just go straight into my presentation, and I hope somebody would be scrolling the slides for me from that side.
Yes, happy to do it. Just let me know.
Yeah, next slide, please. Okay, I will basically start with just giving a synopsis of the policies and the legal instruments that we have that are guiding the implementation of water, sanitation, and hygiene services in the country. There are two major policies that we use in WASH here in Malawi. We have the National Water Policy of 2005 and the National Sanitation Policy of 2008 that we currently use to guide implementation of WASH in the country. And these are backed by a couple of legal instruments, and I'll just mention a few. The first one is the Public Health Act of 1949, quite odd, but it's under review. We also have the Water Works Act of 2005, also being planned for review. The Environmental Management Act of 1996, the Local Government Act of 1997, and again, we also use bylaws that our various councils from time to time come up with in implementation of various activities within their councils. In terms of mutual accountability mechanism, we are also very much as stakeholders in WASH, ensuring that we are accountable to the services that we are providing to the communities. And there are various ways that we are using to track the progress and the service provision that we are making. The first one is we use the process of JSR, where we have reports and plans submitted at this particular meeting, and decisions are made on how we are going to move in that particular year. We also have CSOs, performance reports, that are also presented when we have the joint sector review, so that including the CEOs and NGOs are also accountable to the people that we use. We also participate in other global instruments. For example, GLASS. We do assess our drinking water and produce a report for our country. In terms of how we are championing the inclusivity of various stakeholders in the country, basically what we are trying to do now is to make sure that we include representatives of various groups and the actors. And primarily what we've done as WASH is to make sure that there is inclusion of people that are left behind. For example, the blind, the old, the elderly, the chronically sick people, to make sure that we hear their voice and their interests, so that as we are targeting, we also make sure that these people are included in service provision that we provide in WASH. And we have also created space for interaction with the various players through the West Network membership organization that we have in the country. In terms of how we are positioning Malawi, we've tried to put ourselves as a front runner in innovation in different areas, basically looking at the people that are left behind and also to look at issues of equity and discrimination, basically looking at how we can best ensure that each and everyone is saved properly without leaving not even a single person behind. Next slide, please. In terms of identification of the vulnerable population, yes, as a country, we have also tried to venture into a number of ways to ensure that the issues of equity and discrimination are taken into, and we make sure that the vulnerable are taken into consideration. First of all, in trying to identify these, the ones that are being left behind in WASH, we are using explicit mapping and targeting of those that are potentially disadvantaged, to make sure that as we target, as we look at our various programs, we do not leave these particular groups behind. So there are mappings that have been done, and we also ensure that if they're included, we are also aware of their needs, and also how best to address their particular needs as we target the various cadres of population in the country. The other where we are trying to advance in ensuring that the issues of vulnerable population are taken into is we have also devised a method of communication. Basically, what we have tried to advance is to use the structures of the people that are disabled to make sure that we also try as much as possible that the information that we have that concerning WASH reaches these people, and they're able to be part of the grouping as we make interventions to make sure that they're also included. We have also tried to identify and include the non-state actors, so that we can use the similar approach they're using in other interventions to make sure that the people with disabilities and other vulnerable groups are also included in the programming for WASH. And we have also engaged ourselves in ensuring that we ensure that the issue of equity and anti-discrimination principles and frameworks, as well as the protocols and approaches are used and are incorporated in our planning, in the training that we from time to time have with the various communities, and are also included as we review the various policy documents and guidelines that we use in various activities that we have. So these principles and protocols have basically been used to make sure that the issues of inclusivity is taken into board, and we have everyone taken care of as we do our programming. Next slide. In terms of the policies and strategies targeting the vulnerable groups, yes, of late, I think we are at an advantage point in that as a country, at this particular time, we are reviewing the two most important policies that we have in the country: the national water policy as well as the national sanitation policy, and we've ensured that the revision would be as conservative as possible, as guided by government, and also to ensure that the issues of the people that are left behind and the issues of equity and discrimination are basically incorporated in these policies moving forward, because the other policies really did not tackle much on these issues, and would also want to ensure that as we review the policies, these particular issues and approaches are taken into being to ensure that everyone is accommodated. The other issues is we have identified institutions that are supporting the potentially and disadvantaged population. And we are trying to engage with them in our planning and implementation of the various programs that we have in our country. And basically we are doing this to ensure that the issues of ensuring that we are leaving no one behind, and we find a best approach to make sure that they're included in our programming in WASH is particularly taken care of. And we have also championed the district-wide approach so that we have the district empowered to make sure that they are able to handle issues of WASH in their programming at that local level, and they're able to help, because the actual implementation of all the activities we're talking about basically are happening at that particular local level. And we need to make sure that they are empowered and ensure that they're able to come up with programs costed, and are able to also find support for those particular activities with support from central government. Next. We have also tried to just give an example on how we are working with the vulnerable communities. For example, some CSOs and NGOs. In terms of, for example, selection of a venue where particular meetings regarding the various interventions we are doing are happening. Some development partners, CSOs, have devised a way of ensuring that we consult potentially the disadvantaged people on appropriate and decentralized meetings venue, where traditionally probably they were in places that were central to the people that are implementing, but were not accessible to the disadvantaged groups. So to ensure that these people are accommodated, even issues of where these particular meetings are happening and the like, we've tried to make sure that there is proper consultations from including the disadvantaged groups, so that they participate and they're able to make sure that their voice is heard as we are coming up with various interventions. We've also strengthened partnership with some CSOs that are working with the vulnerable communities. For example, we have a CSO that is Kahesh, that is able to translate material, including the COVID-19 information. They have translated that and ensured that the people that are visually impaired are able to also get that particular messages and are able to follow the guidelines that are being provided to the various communities. And we have also trained interpreters on technical content of the actual interpretations. And again, resource persons have been put of interpreters to be able to train on sanitation and hygiene, as well as the various technologies that are there. So WestNet member, as I've indicated, Kahesh is doing a lot of these particular activities in Braille translation to make sure that we do not leave this particular kind of people behind. Next slide, please.
1 minute, Ms. Mpalana.
Yes, in conclusion, I'll just briefly talk about sustainability approaches that we are trying to adopt, especially in the time where we are now. We have looked at our focus has been on special interest groups. For example, as I did indicate, we've looked at how we can reach the visually impaired people with the messages in WASH. And as I did indicate, we are already coming up with interventions to make sure that they are included. We've also looked at the people that are physically disabled. Approaches by different partners supported by government are also being taken into board. We've also looked at the people that are living with albinism. We had a challenge here where we had people attack these people, and basically it becomes very difficult sometimes to mobilize and ensure that they become part of larger community meetings because of the different challenges that they have faced, but we want to find a way of ensuring that they're included. And other intervention at national level includes, we have used the voice, we've increased the voice by using other interest groups. For example, we have PEDOMA and Makoha. They advocate for policy change so that the people with disability and the vulnerable are included. We've also ensured that at local council, the district coordinating teams are also part of the approaches that we are using, as well as schools and the communities. We are also finally cascading the EQND approaches in our MAM, and finally, we are using the tools to capture the EQND approaches in our programming. At this point, let me conclude my presentation. Once again, thank you for allowing my government to be able to participate in this webinar. Thank you so much.
Thank you, Ms. Mabalana from Malawi, I think, for a very thoughtful presentation, from mapping and data to critically revisiting existing frameworks to really also involving vulnerable communities themselves into the responses to COVID-19. I think a very broad presentation. Thank you very much and well done. Without further ado, I'd like to see if we have, do we have Dr. Chengo?
I believe so.
Dr. Chengo, are you online? Have you been in touch with him, Marissa?
Yes, he is online. Marissa, could you try to unmute him?
Yes.
I'm hearing something.
Hello?
Hello, Dr. Chengo?
Hello, everyone?
Yes.
Am I audible?
Mr. Chengo, we're having.
Hello, everyone from Nairobi. Am I audible?
Yes, go ahead, Dr. Chengo.
Okay, thank you very much. And it's a pleasure for me to join you this afternoon. Activities that we have been able to do in Nairobi as far as addressing the three questions that we were requested to address. Engineer Chengo from the Ministry of Water and Sanitation and Irrigation in Nairobi. Yeah.
Dr. Chengo, we have difficulty hearing you.
Yes, sir.
We have difficulty hearing you. Is it possible to improve your connection to the internet? Dr. Chengo?
Joost,
Yes.
it looked like his line has dropped actually.
Okay.
So we can try and call him and see if we can maybe do it that way, but let's go ahead and move along to WaterAid.
Yes, yes. Thank you very much. We'll be working on Dr. Chengo as we move along. So now I'm pleased to introduce Ms. Priya Nath, who's the Equality, Inclusion and Rights Advisor at WaterAid. And WaterAid is, of course, a trusted partner of SWA, and we're very happy to have you here in the webinar. And perhaps you could give us a short presentation about what is the work that WaterAid is doing during the COVID-19 response. Ms. Nath, over to you.
Thank you everyone, and it's a real pleasure to be here and to be part of this vital conversation from WaterAid's perspective. So next slide, please. I've been asked to address these 3 questions, so let's just move straight into it, into the next slide. Just to start by saying that, sorry, next slide. Start by saying that in the pre-COVID world, tackling inequalities in WASH was one of our big strategic aims for WaterAid, and it's supposed to be ingrained in everything that we do. So we have for a long time had some focus on particular spatial locations that we know are most marginalized from WASH access, or particular groups of the population whose water and sanitation rights might be compromised, or individual characteristics that, such as gender or disability status, that we know impact so much on someone's requirements for and experiences of water or sanitation or hygiene. But the COVID crisis has really reminded and reflected just how much these inequalities exist, how deeply ingrained they are, but also how central they are, these factors are, to our any WASH response, whether it's in the short term or in the long term. So like for many others, what we have found is that it has reinforced what we already know about how particular types of people or groups or places are currently struggling with their WASH, but it's also exposed some other inequalities or areas that we have not focused on before, haven't thought about, or parts of the population that we have just not connected with in our WASH work. So it is really fast becoming apparent, as for everyone, to quote the UN report, that while the virus does not discriminate, the impacts and the actions taken in response definitely do, as they do in normal times. Next slide, please. So I want to share with you some of the principles that we're trying to apply to our work to make sure that it really does tackle issues around marginalization or vulnerability. So I'll share with you the principles, but then also some examples of the practice that we're starting to see, bearing in mind it's very early stages, that a lot of the initial response was very top down and very public health focused, but we're seeing this starting to evolve already. So number 1 in terms of our principles is really going back to what one of my colleagues said, is going back to basics, starting with analysis. So while we might know clearly the barriers that some groups or peoples or locations right now might be confronted with, we have to work fast to understand the additional risks and repercussions they are dealing with because of this COVID situation. We need to understand who is missing out in the response efforts, who is being adversely affected by the response at every level. So our colleagues in Zambia and Timor, for example, are supporting vulnerability assessments to take place in collaboration with local authority or with their CSO partners to make sure that the picture is really clear to support the response design. Whereas in Cambodia and Myanmar, they are already working based on previous assessments, working with informal workers in factories or construction sites, because they know of the existing lack of information and lack of water and hygiene provision in these places, and so is supporting the response in those areas. Meanwhile, in South Africa, the new COVID-related risks have led to increased domestic abuse centres being set up. So there, WaterAid is supporting the WASH and the menstrual hygiene and health facilities in these new locations. So this is a new way of working for us, but working with government and women's organisations to quickly respond. Number 2, secondly, grounding our work in conjunction with representatives of marginalized groups or rights-based organizations is so important now more than ever. This has to be in the analysis, in the planning, and in the delivery, so that we're really supporting real requirements, so that we're responding to real realities, and that we're not doing any further harm. So in some places, as I said, we have long and strong relationships with disability rights organizations, indigenous rights organizations, women's rights organizations, or slum dwellers associations. And this has enabled us to act a little bit faster. For example, in Eswatini, where they're working with their disability rights partner on hand washing and hygiene materials that are most appropriate for people with disabilities, and particularly for people with hearing impairments. Or in Zambia, where their disability rights partner has been able to really do quick assessments with them about the barriers that touchless hand washing facilities have for people with disabilities, that they're just not that suitable to some parts of the population, yet they're being rolled out massively. Thirdly, our messaging and delivery has to really reach everyone, but also to tackle discrimination and stigmatization as part of the response. From the last speaker, we heard so clearly about the stigmatization, for example, that existed pre-COVID for people with albinism. It exists for people with disabilities, and it has showed up at places like water points or sanitation facilities in the past. This doesn't go away in a COVID world, and in fact, it's intensified. We're seeing racism, we're seeing profiling, discrimination against people based on their health condition, which is, you know, spread through misinformation rather than fact. So in WaterAid's messaging, where we're supporting the scale up, we're working with government of hygiene messaging. We have to be really clear around avoiding stigmatization, around making sure that these, as in Nepal, are translated into local languages so that they have better reach, and that they also target people without access to certain technologies. So in Nepal, they're doing a lot of loudspeaker miking rather than relying just on one form of delivery. In a lot of WaterAid countries, this has also meant intensifying work with sanitation workers associations, who are a very often stigmatized part of the population, but really advocating for their protection, for better equipment, for tackling their stigma and their status, and the risk, exposing some of the risks that they're up against right now more than ever. And I'll move on to the next slide, please. Number 4 is really recognizing and tackling the increased gendered burden of wash and care work that is happening now in this COVID moment, but that was really, really present before COVID as well. So it's been very important for us that we promote water collection, cleaning, hygiene as everyone's responsibility, not just women's. So to support this, we produce things like do's and don'ts, guides for communication campaigns, so that we don't re-emphasize gender stereotypes in this time. And also we recognize that, you know, while we work with utility workers and wash officials and technicians, you know, and we really support their work and we want to involve, we have to recognize also that these are oftentimes mostly male, and that there's urgent support needed and women's participation needed in the responses at all levels. So this is a longer term piece of work, but it has to be addressed also in the short term response. Our colleagues in Zambia are deepening relationships with women's rights organizations so that they can tackle wash work, but then alongside the women's rights organization who's tackling the violence that is so clearly coming up in this time of crisis. Fifthly, none of our work should be happening outside of or in parallel. So we really work with governments, with utilities, with service providers, so to help to support them in their obligations to respond to all of these groups, rather than creating any sort of parallel structures. So in this regard, in Pakistan and India and Myanmar, there's been fast work with local authorities and national authorities on short-term hand washing and soap provision in townships or informal settlements. In South Africa and East Africa, they're really, you know, advocating and supporting this reduction of tariffs or removal of tariffs and commitment to no disconnections in this time. But alongside all of that, for sustainability in the long term, it's really important. WaterAid is trying to work with utilities, work with service providers to develop continuity and equity plans that go for the longer term, not just in the short term phase. And finally, there was some good stuff said about the need for using the data that we already have and the information systems we already have to map out where the vulnerability lies, but also to acknowledge that there is a lack of disaggregated data, that we need more. And we also need more about how this response, how this pandemic is affecting different parts of the communities and different parts of societies in a different way. So I'll well, just one example of that, for example, is using our evidence in Southern Africa. They've been doing formative research over 6 months or so on what are the barriers and motivations for hygiene behavior change across 5 countries. And using that kind of data now is more useful, is very useful and still very needed. So next slide, please. So I've been asked to talk about what does this all mean in terms of sustainability. And I just want to emphasize that while we're acting in a certain way now, we're trying to plan our work over a very long time, a minimum of 12 months. So it's situating it in this longer term planning work, so that the program planning, the short-term efforts that are happening now filter through into boosting WASH access with stronger commitments in the longer term. But we have to acknowledge also that that before the crisis and after the crisis, there will be this financing gap for WASH. So there needs to be increased levels of investment to be able to sustain the services and to be able to make services reach everyone. There needs to be investment by governments, by service providers, by private sectors and users themselves. All of these have to be conversations that still go on and are still considered. And finally, I would say in terms of sustainability, really, really important are these partnerships with these rights-based organizations, with marginalized groups in our work. They have to be stronger for the future. We have to recognize the mutual goals that we have, and we have to avoid going back to this business as usual situation where WASH is partnerships don't include this wide variety of CSO and different parts of the population. Next slide, please. So I think that's it for me. I'll just share some pictures here of some of the hygiene behavior change work going on. Thank you.
Thank you very much, Priya. I think for a very broad and interesting presentation, very encouraging to see how much is already being done. What also struck me is that you know, in all the 3 presentations we heard, there are a lot of I think there's a lot of consensus on what some of the measures need to be. I thought the you know, the involving communities themselves, mapping and data, advocating for human rights principles, key issues. But I think Priya, you also added attention to gender and the special position of women. That in terms of you know, we need to make sure that women participate in decision making about the response of COVID-19. You also mentioned the service providers, and that's an interesting topic. I think there's being a lot asked of the service providers during this crisis, and you have to stay tuned. In a few weeks, we will have a webinar that specifically will focus on the role and impact on service providers in the sector. So thank you very much. Also stay focused on the long term. I think that's another, I think, interesting message that Priya gave us. Now, I think that we will not be able to hear Dr. Chengo's presentation, so I'm very sorry that the connection with through the internet was not good enough, but we will make sure that his presentation will be put online together with the recording of this webinar that we will also put on our website. So
hello everyone. Hello?
Yes?
This is Chengo. Chengo, can I help people now?
If your connection is great, then I would say yes, you are very welcome. If you would be so kind to keep your presentation to 5 minutes so that we can stick on time. I'm sorry about the time constraint. Dr. Chengo, the floor is yours.
Thank you very much, and sorry about. Okay, thank you very much, and sorry about that interruption. I'm Chengo from the Ministry of Water, Sanitation and Irrigation from Nairobi. I'll very quickly answer those 3 questions, those issues that we were requested to respond to. In the next slide. We have been able to really, the issues we have been able to identify in our population, who is really the vulnerable groups. And they have been able to highlight the the key vulnerable population that we think about as we address these issues. The informal settlement grounds, especially for the casual laborers, daily workers. We think very much in Kenya about the rural population literacy level. We think about the health workers, together with the elderly and the people with disabilities, and again, people with chronic conditions, population in the prisons, and this is an area which is very vulnerable. And in general, the underserved population with water and sanitation services across the country. Again, in Kenya, we have a big population of the refugee population, and this is a critical group that we are focusing on best to make sure that they're not left behind. They continue to get water and sanitation services in the country. In the next slide, I am highlighting some of the policies and actions that we are put in place to target the vulnerable. Of course, we have the overall national coordination framework that includes both national and county governments that is coordinating the approaches to address the areas. We have a thematic response team that looks at the WASH, basically looking what are the interventions that the WASH space needs to be able to be part of the solution to this pandemic. We have an emergency fund that is also allocating some resources available to the WASH sector to intervene. And at the WASH level, we have an intervention coordination mechanism together with the county governments and our partners that is looking at the solutions, looking at the interventions, and looking at identifying gaps where we need other partners and players to play their role. As a ministry, both health and water, we have been able to give WASH protocols and regulatory advisory, which we are monitoring, and this is applicable to all our service providers, both urban and rural. Together with the Ministry of Health, we have been able to identify the hotspots across the country, about 4,265 hotspot sites that have specific interventions, particularly because we know these are the areas that can make or break the process. And like I mentioned, we have the vulnerable groups, and we have a program of sensitization and awareness creation and promotion of hand washing with soap. The next slide. We have been able to set up, again, national and county WASH coordination committees, where all the interventions, all the planning, all the monitoring, evaluation, and investment are going into in that process. We have been able to advocate and put in place an increased investment, particularly to address the infrastructure that is required to keep the taps running, particularly among the vulnerable groups. And together with our non-state actors, surveillance, evaluation, and sharing of data and information across the country. And we have also been able to develop a digital platform for information sharing, data and insight sharing among stakeholders. And this is a key element with the input of local leaders and community leaders across the country. The next slide, I'm sharing some of the interventions which demonstrate our focus on the vulnerable groups. This is just an the other slide, the intervention of the market centers, CBDs, bus stops and parks, informal slums areas. We've been able to put up hand washing and storage facilities across the country. That is the intervention of UNICEF. Again, looking at the hotspots which have been identified in terms of what they need to implement, and it's quite a useful intervention. What I would like to mention is that in Kenya, we have already mapped our informal settlements. Already we have a map, we know where they are, we know the and it's very easy for us to know the intention behind. This is one of our partners who is ensuring that 150,000 people in a informal settlement continues to get waste collection services, and we want to scale this to 1 million among the population. This is very important as we address the challenges that we have. In the next slide, we have a partner who is also addressing the aspects that relates to, in the next slide. Yes, this is also a demonstration of what other partners are doing. Again, the focus is the vulnerable group among the informal settlements, huge numbers that are involved, and good responses from our partners to look at installing handwashing facilities, keeping the taps running, providing additional water, and giving soap in the process. During that post the pandemic, then we have sustainable service provision across those areas. The next slide. One of the partners is particularly addressing aspects dealing with the refugees. I think this is addressing, ensuring that the refugees in the prisons and
Dr. Chengo.
Ensuring that we have water, we have running water in the health facilities. And this is an example of the numbers that we assistance. And yes, that's the last slide. Thank you very much.
Thank you very much, Dr. Chengo. I think a very interesting and detailed presentation, and I think your presentation also underlines what Priya did in the previous presentation, making the point of the importance of partnerships, especially when it comes to vulnerable communities. And I think in your presentation you show how partnerships, both with international organizations as well as NGOs and other actors, is key. Could you please mute your microphone, Mr. Chengo? Thank you very much. Marissa, I think that
yes.
we can.
Yep, I'll take care of it.
Yeah, thank you. So now we're going into the question and answers session. We're first going to get some questions from the floor that I will pose to some of the participants. And I'm going to do this really quickly, and I'm asking those participants to respond within 90 seconds so that we can stick to time. And the first question will be to Murali from the Freshwater Action Network in South Asia. Murali, I'd like to ask you, how did FANSA adapt its work during the pandemic, and how are you addressing the importance of reaching the most vulnerable, and what do you need from governments, donors, private sector, and INGO? So Murali, the floor is yours. I'm hearing some background noise.
Yeah, thank you very much. Thanks for those wonderful presentations, which will definitely benefit my further work in the current context in COVID-19 pandemic situation. Responding to your question, I'm based out of a city called Hyderabad, where we have about 12 million population. And from March 22nd onwards, lockdown situation is continuing. The government has declared that the lockdown situation will continue up to 7th May here in the city. So, and government has also appealed for the civil society organizations to supplement the efforts of the government in providing relief to the most affected communities. However, as a civil society organizations, we need to go through a process to take permission from the government to implement the relief activities. So in our response to COVID pandemic situation, we have mainly focused on three most vulnerable groups. Number one, people living in informal settlements. even the informal settlements where the relief support from the government agencies has not reached. Maybe it has reached, but it is very insufficient. We have selected such informal settlements and trying to provide relief support, which includes mainly dry ration, which includes cereals, pulses, oil, sugar, and other condiments. That would take care of the food requirements of a family of 4 to 5 members for about a month. These are really very poor kind of households where we are providing this relief. And the relief support also includes the personal hygiene kit, which has basically sanitizer, hand gloves, masks, and then soaps for washing clothes and also for bathing, etc. So that's the personal hygiene kit. So this is a, there are many informal settlements, but we have selected the settlements where the situation is really very bad and which are inhabited mostly by the waste collectors, rack pickers, and very small vendors, petty vendors, etc. So this is one vulnerable constituency where we are trying to provide relief support. So far, we have covered about 2,100 families. And number 2 is many homeless people, people like beggars, people living on the pavements, migrant workers who are stranded. They've all been lifted and temporarily housed in shelters built by the municipal corporation. The facilities are very poor there. They have water, but they don't have buckets, mugs to take a bath. There are lots of mosquitoes, and somebody is providing food, but there's no facility to hand wash, to wash the plates and things of that sort. So what we have done is we have tried to do a kind of rapid need assessment of these temporary shelters where large number of people have been housed and responded to the needs of those shelter homes. Again, hygiene kits and also other things like mosquito repellers, toothpaste, toothbrush, and lights. Those are the kind of basic requirements for them to be able to live in those temporary shelters required. And we, as part of relief support, we have provided that material. And similarly, the frontline sanitation workers, there are different layers of sanitation workers. I think the people who are exposed to highest level of risk are those who are maintaining open drains, those who are cleaning the sewerage lines, and also the people who are sweeping in the streets, etc. So for these frontline sanitation workers who are daily wage laborers who are employed by the contractors, for them again providing hygiene kits and also awareness in all the 3 constituencies, the informal settlements, homeless people, and frontline sanitation workers. In all these 3 constituencies, improving the level of awareness and the kind of practices required for protecting themselves and to protect others. That was very important, which we are focusing as part of our relief work. And responding to your second...
So we have only a few seconds left in order to give time to the others. Mr. Murali, is it okay if I...
Yeah, I think just to highlight most important points, I think the data is not really, the real-time data is not shared in terms of containment zones and where is relief really reaching, where are the gaps. That kind of data is not really shared on a regular basis, which is creating a lot of problem. There is a duplication of effort happening, etc. I think overall, the governments need to strengthen the coordination mechanism, coordination of what is happening between different agencies of the government and what can be done by other non-governmental actors. People are doing something on their own. I think overall coordination mechanisms still seem to be very weak. I think that's an area where a lot of work is required to be done. So that's where I stop. And also advisory, particularly keeping in mind the conditions of the informal settlements where outdoor space is very limited. And in a room of about 24 square yards, I have seen 10, 12 people living. So their social distancing is absolutely impossible. So what is the kind of advisory that can be specially thought about for these kind of conditions is something that government need to come out with. Thank you very much.
Thank you, Mr. Murali. Thank you. I think very elaborate answer. Thank you. Just in the interest of time, I'm going to move on to Musa. Musa Assoumana Moka, who is the CEO of Water Sanitation Hygiene Network in Sierra Leone. Musa, could you tell us something about what did you learn from the Ebola crisis a few years back in Sierra Leone, and how are you applying these lessons in the current fight against COVID-19. Thank you.
I am Musa and I'm from Sierra Leone. Directly going to the Ebola context at the time, basically, we had the outbreak affecting over 4,000 Sierra Leoneans and over 3,000 dying as a result of the outbreak. But there were lessons basically we vividly learned from the response process, either the response level, the prevention level, or at the level of the community that, you know, had to face the both realities of what happened. So quickly, we have this quick policy and legislative environment, looking at water supply and sanitation, as well as the health sector and other key players within that policy and legislative environment. So we had policies in place like the wash policy, the poverty reduction strategy, the urban wash roadmap, as well as the Ordinance Act specifically for sanitation. So in the context of that, when the outbreak struck, you know, it became a very serious concern, particularly for frontline responders, you know, in the health sector. So everybody at the time, you know, was unsure as to which way to start attacking a nascent virus like that at a time when we have never experienced such kind of outbreak. So to be more specific, beginning with the lessons, one of the key lessons that we were able to learn from such a process was that there was this seeming lack of trust, you know, from people, particularly at the community level, you know, towards responders, either at the healthcare level or at the armed forces level that we are working on enforcing quarantine measures to be able to ensure that citizens are complying with quarantine rules, you know, or, I mean, and particularly their local chiefs were also experiencing that level of mistrust, you know, in the response system. The other related lesson that we also learned from that was that medical technologies alone are not enough to prevent and respond to outbreaks like that, you know, without making conscious efforts to gain trust from those communities that were largely faced with the realities on the ground. You know, so we further learned that, you know, when it comes, you know, to instances of outbreaks, particularly, you know, they are not only a major cause for societal disruption in the context where they happen, but they do also have tendencies of, you know, spillover effects to other countries, like what happened in Guinea and Liberia. We got our first case coming in from Guinea, you know, when Liberia and Guinea at the time were already experiencing, you know, the outbreak. Just as it is now with the coronavirus, we got our cases, you know, coming out of the country. So outbreaks, you know, like corona or Ebola, they are not really specific to where mostly they break out, but certainly countries must also be very critical and be prepared to be able to also respond in the event of, you know, outbreaks in their respective areas.
Thank you, Musa.
We also learned, you know, to a very large extent that the EGD in particular exposed how weak the health system were, particularly when you look at the poverty and economic fragility, you know, that fueled those outbreaks. So we felt it's also very important, you know, that we look at inequality in the context of those political as well as economic stabilities that were already on the line, you know. So once outbreaks struck, it becomes easy. It becomes easy to also eat into the already rich system, where communities, including those hard to reach, must also be at the center of the response process. The other last one I would say was also, very visible in the lessons was that it came out very clearly that countries must strengthen their capacity to prevent, detect, and respond to outbreaks with commensurate domestic and, where necessary, international investment. When you look at water supply and sanitation at the moment, even when the heightened demand is there, it is now in fact very difficult for communities to have access to it. When you look at the need for water services as the first line of defense at this critical moment, in addition to other instances of social distancing, among others, it is now very critical and very difficult for governments, in fact, to scale up access, when already we have not invested so much in the previous past. So these, among others, form the very lessons that we were able to also learn from the response process. And quickly to go to the first question of the second question of what is missing, in the COVID-19 response drive, particularly as it is now in Sierra Leone. What we feel is missing at the moment is still the fact that, even when in the middle of the response process during Ebola, we were able to take communities along to accompany the response drive, but it's still very much feeling that we have not learned so much to be able to also inform the current response processes with COVID-19. Communities are still very much largely left behind, particularly those hard to reach, in terms of information, in terms of access to basic services. They are still very much hard to reach, and they continue to be cut off from those services and information, hence deepening the aspect of inequality, and marginalization. When you look at, for example,
Musa, can you wrap up your answer, please, in the interest of time?
Yes. I'm wrapping up now. When you look at, for example, the number of population with access, to radio listening ability, or certainly access to radio, it is still very minimal. We have a bulk of over 79% of citizens not having at least something to call a radio. So when you look at access to information, people must be there to be able to reach out to the hardest hit communities to be able to ensure that these people are not left behind the response drive. The other aspect of where we feel is also very critical and still unaddressed and unmet is the aspect of making sure that there is this critical involvement of civil society. This must go beyond government-centered response, but we must bring the critical voices of citizens and their institutions to be able to inform the response drive. So far, these are the key areas I feel is still very critical and remain unaddressed. I hand over back to you. Thank you very much.
Thank you very much, Musa. This was, I think, very interesting to learn those lessons. In the interest of time, we will not really have a lot of opportunity to do questions question and answers. So we're asking the panelists to engage in the chat to any questions that might be directed at them. And I also want to assure everyone that we're keeping a record of the questions that are being asked. And of course, the work about giving guidance to our partners is not done with this seminar when it comes to leaving no one behind. And I think that the questions and remarks that you're putting in the chat box are going to help us to frame, the next work that we're going to do in working with you on leaving no one behind. So everything that you put in there is useful. Thank you. I just want to quickly turn now to Ms. Saima Ashraf, who is the president of the Asian Cultural Research Center in Pakistan and also a UNICEF Global Goodwill Ambassador. So Saima, if you're online, how do we include and target these different types of communities in the response to COVID-19, such as, for example, women and people with disabilities? Over to you, Saima. And if you could give your answer within 90 seconds. I know it's very short, but that's the reality.
Sure. Thank you so much. What I have to say today is women, transgender, and people with disabilities are more vulnerable in the context of COVID-19 because of the existing inequalities. Due to gender division of roles, the domestic burden greatly increases for the women as they are responsible for not just their household, but also caring for the elderly and the sick. In some countries, the role of traveling a long distance to collect water and other commodities also falls on the shoulders of women and the girls. Persons with disabilities have always limited exposure to the outside world, but this lockdown is creating more troubles for them, especially when they are dependent on either their family members or extra assistants. Their consistent wash needs are another big issue, especially when they are dependent on others. Their hands as well as their assistive devices need to be sanitized more often because they may not follow social distancing if an assistant is helping them all the time for their basic needs. They even have an added exposure to the virus through their caretaker. So focusing on them is supremely important because COVID-19 infection of one PWD can lead to the corona positive of the entire family. So what I recommend here is public health and information messages in the form of audio, video, and sign language patterns should be floated to avoid rumors and disinformation about coronavirus. So these messages should be spread that the people with the disabilities should keep their hands and assistive devices sanitized off and on, and more frequently than they are doing before. And number two, local government authorities should develop crisis responses alongside the affected communities so that the solutions meet cultural, social, and religious communities and challenges. Support of the CSOs as those working for the people with disabilities and for women rights are best placed to shape the response as also necessary. And number three, collecting disaggregated data to understand the different impacts of health emergencies on all parts of the population, especially those who are vulnerable and marginalized, also should be emphasized. So my organization, Able Plus, has planned for such an intervention to conduct research on COVID-19 and the disabilities of all types by conducting surveys in Pakistan. We are also working with our counterparts to create awareness on people with disabilities and COVID-19. We are also continuing our work to highlight the water and sanitation problems faced by the students with disabilities in universities across Pakistan. So this is all from my side with the 90 seconds. I hope it makes sense to you all. Thank you very much for your time and attention.
Yeah, thank you, Saima. I think it made a lot of sense, and I think it really also tied in with the previous presentations about the importance of connecting directly to vulnerable people and also doing advocacy and comms about this. We're also looking forward to the research that you are conducting. So I'm going to my last intervenant, who is Ms. Sheila Patel, and she is the chairperson of Slum Dwellers International. In 90 seconds, Sheila, what can you tell us about the plight of slum dwellers during this pandemic?
Thank you very much. I'm going to try and see if my stopwatch can help me. I want to say that I am very concerned about the fact that none of the conversation is actually looking at the roles and responsibilities of international and national institutions and the fiscal choices that they make that will impact the lives of the urban poor. Right now, for instance, most of the countries are obsessed with purchasing ventilators through the loans that they are getting from the World Bank and the Asian and African development banks, when in reality, the issue of fundamental water and sanitation, the issue of primary and secondary health care, better detection, better medicines, as some of the others have said, needs to be negotiated and asked for. Nobody's talking about the fact that WHO has no answers for what to do with all the health advisories. I mean, here we talk about lack of water and soap, but what about social distancing? What about quarantine? What about the deep old-fashioned laws? I know, for instance, in all countries which were which were part of the British Empire, the plague of 150 years ago has put the most punitive laws on segregation and eviction of informal settlements, and nobody's talking about that. And as we speak, there are evictions happening in at least 25 of the cities in which we have STI federations. We work in almost 500 cities and 33 countries. And in all the countries that we are talking about, there are either evictions or threats of eviction. People are getting food not through entitlements that they should deserve, because the lockdown was not something that they wanted but was enforced by government. Civil society is forced to collect money and give food when it should be the business of the nation state to do that. And there is no discussion of what's going to happen after the lockdown is open, because everybody who's an epidemiologist is saying there are going to be spikes. So there's going to be a huge challenge for the next year and a half. COVID is not going to go away by the end of May. And I think, as was said in the introduction by many, and I think by Katrina and others, that there has to be a new normal. COVID has demonstrated what something that happens in one country can impact the whole world. I'm also part of the Commission on Adaptation for Climate Change. There's a parallel track that goes exactly like this, which says you must have organizations of the vulnerable represented on discussions about strategies. No government has till now asked organizations of the poor. There are global social movements of what they can contribute to change things, like Murali said. How do you produce isolation in informal settlements that are dense? So my request to all of you is that we have to look on both sides. We have to look at what we can do to support and assist communities. We have to create citywide, nationwide networks that bring the voice much higher than they are now. And the second thing we have to do is we have to make the international financing institutions accountable to these people. No longer this rubbish about rhetoric. No longer for people to say, oh, we can't give money from climate change funds because water and sanitation is for the SDGs 11 or whatever. So I think this is a very important group of people, and I want to include SDI's voice in it to say, let's seek accountability and commitments on all sides. And I want to say that for the issues of the urban poor, this is a very, very important episode of crisis. And I think we have to give them a chance to make their representation to their cities. We want to make mayors accountable for the role and contribution that they have to play to be faces of trust, respect, and caring, and not evictors. So thank you.
Thank you, Sheila. I think that's a very powerful message. COVID-19 also, as you said, is not going to go away. We have a job to do in the coming months, and I think it's very important to also have these conversations about accountability, fiscal choices, and financing, and making sure that our governments are held accountable for what they do in this COVID response. So thank you very much. I thank everybody for staying on, even though we've gone over the time a little bit. I think the fact that there are still over 200 participants underlines, I think, your commitment and interest. I would now like to turn to Ms. Leilani Farha for some concluding thoughts. Ms. Leilani Farha is the United Nations Special Rapporteur on Adequate Housing. Please, Leilani, over to you. And for some concluding thoughts. Thank you very much.
Thank you very much, and good morning and good afternoon and good evening to everyone on the call. I just want to start by thanking Katerina for inviting me in to speak with you and listen to you and learn from you. I began my mandate working with Katerina, and it's a distinct pleasure to end my mandate. My tenure is finishing next week, and it's a pleasure to be finishing it in the company of Katerina, who is such an amazing advocate herself. One of the things that I've noticed, not just through our conversation, but of course through the pandemic as it has been unfolding, is that there is, of course, a symbiotic relationship between access to WASH and access to adequate housing. And I think Sheila just highlighted that for us in a very powerful way. We know that those who don't have access to adequate water and sanitation are living in the worst housing circumstances. People who are homeless and of course people living in informal settlements without access to basic services. Obviously the connection between water and sanitation and housing has been highlighted in a kind of Uber way in the response and the proposed response to COVID-19. You know, this really, you know, came home. I understood this so, I don't know, personally, of course, when my own government started in on the mantra that is, in fact, the global mantra dictated by the WHO, which is that we all should be staying home, washing our hands, and engaging in physical distance. And it really has become a mantra, you know, it's like on a repetitive wheel in my own brain as I try to protect my own family, that we must stay home, wash our hands, and physical distance. But of course, it's a policy, and I hate to say it, but it's a health policy that is inherently discriminatory. I mean, it's neutral on its face. It seems pretty ordinary. Stay home, wash your hands, physical distance. It makes sense in light of this new virus, but it does have discriminatory effects. And I think many of the people who've spoken today have highlighted the way in which stay home, wash your hands, and physical distance simply doesn't work for a huge segment of the population. 1.8 billion people across the world live in grossly inadequate housing, lacking access to water and sanitation, and living in homelessness. So though we know it's the right approach, we know that it also requires of states that those who cannot abide by the policy must be facilitated and supported so that they can. And you know, I think the other panelists and many of the speakers have already detailed various ways in which this can be accomplished. So I'm not going to obviously delve into details. I have developed a series of guidance notes for governments and other actors, but they are aimed particularly at states and all levels of government to help guide how do we ensure that the most marginalized and vulnerable populations can themselves stay home, wash their hands, and physical distance. The ones that might be of particular interest to you, I've released 5, or I'm about to release the 5th one next week. I released today one on evictions that goes directly to what Sheila was talking about. I've released one on informal settlements, and I've released one on homelessness. And all of them include measures regarding water and sanitation. I want to say to those of you who are working with government and for government, I recognize this is not easy. You're trying to solve a lot of problems very quickly, and there's a race against time here. You're trying to save lives, and I really respect the work that you're all doing, and I respect that it's not easy. I guess I'll conclude with what I think are just some key principles. I'm reiterating what others have already said, but it might be useful. First of all, it's obvious that any response has to involve people and communities and the marginalized within those already marginalized communities. So for example, when informal settlements are being engaged and water and sanitation services are being provided, and soap is being provided, and all of these measures, you have to make sure that you're actually engaging not just with the recognized community leaders, but with others as well, because community leaders don't always represent the will of all the people. I think in your work, you really do need to make the connections that Sheila was talking about between water and sanitation and adequate housing. And to remember, of course, that what you do today lays the groundwork for the future. You should be on the path toward the realization of the rights to water and sanitation and the right to adequate housing. So use this time, use this opportunity to lay the right groundwork, the groundwork that puts you on a progressive path toward the realization of those rights. I think that international cooperation is going to be key for so many different governments, and so too will the international financial institutions. But there have to be accountability mechanisms for all actors, whether it's for national governments or for the international governments or the IFIs, international financial institutions. We have to establish at international and local level, domestic level, accountability mechanisms to make sure that when money is being spent, it's being spent to protect the most vulnerable populations, to ensure that that the measures are actually reaching the most vulnerable populations. It's only through accountability mechanisms that we can ensure that the response to COVID-19 is effective. Excuse me. And I agree with what has been said about strategies needing to be targeted. It's so important to be able to identify who are your marginalized and vulnerable populations, who are most susceptible to COVID-19. And in that regard, I want to highlight homeless populations. They weren't referred to very often or by very many panelists. I think only two speakers mentioned the homeless population, but they are so desperately in need of water and sanitation and disinfectants and protective equipment. And they are a forgotten and very invisible population. But you cannot have an effective stay home policy if you don't extend protections to people living in homelessness, people living under bridges, for example, and on pavements. They are particularly vulnerable to COVID-19 because many will have a history of respiratory illness, pneumonia, etc. And at the same time, if you don't protect your homeless population, you're not protecting your population at large. And I'll just conclude now by saying that the work you're doing is so very, very important. It is, in fact, the most essential human rights work. You are all implementing human rights. In particular, you're protecting the right to life. It's so serious what you're doing. And I applaud your efforts, and I ask that you bear in mind what's at stake here. Thank you.
Thank you very much, Leilani Farha, Special Rapporteur on Adequate Housing. I think for these rousing and moving words, and as you said, it's all ultimately it's about people, and that we should never forget. Thank you very much. You also referred to the guidance notes that you're putting out, and I think that we will be able to, we would be very happy to also disseminate them through our COVID-19 SWA information page on our website. And I'm actually drawing all your attention to that site. There's a lot of resources and information available, stories from countries by our partners. So there's a lot of information. Please go to that website. I am going to conclude the webinar now. We're a little bit over time, but it was so interesting to hear about everything, and also to read all your comments on the chat box. As I said, those comments are still going to be used by us when we plan our next activities on the theme of leaving no one behind. So thank you very much. I also would like to thank our co-conveners, WaterAid and the Water Supply and Sanitation Collaborative Council. Thank you very much. Stay tuned. There will be more interesting webinars in the weeks to come on the topic of the COVID-19 response. I wish you all the very best, and stay safe and stay healthy. Thank you very much.